The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, and that is a new treatment option for people suffering with gum disease. And on the second half of the program, drop dead gorgeous dentures. With us, we have an expert on the topic, Dr. Dwyer. Dr. Dwyer, welcome to the program.
Pleasure to be here, Randy.
So with the current treatment of gum disease, how is what you're doing different than traditional gum treatment?
Traditional treatment is addressing the infection under the gum.
Okay.
They're going in with a scalpel.
So gum disease is an infection under the gum line?
Correct.
Okay.
Correct. In traditional treatment, you go in with a scalpel to cut away the diseased tissue. And then you sew the gum back down and place a pack and send the patient home. A month later, do another quadrant.
Is that painful?
There are complications with it. There's swelling, there's discomfort, there's sensitivity. It's a challenge for people to get through. The laser treatment, we do it in 2 appointments. We do it within a week. And there's no cutting, no sewing. Another thing that laser allows us to do is we don't have to remove all the diseased tissue. Because we can get a lot of the diseased tissue to become healthy, restore it back where it was. So we don't end up removing as much. You don't end up with a recession that you can get quite often in conventional treatment.
So in essence, with gum disease, so I understand this.
Correct.
Okay, so it's an infection under the gum line.
Correct.
Okay. So the way it's traditionally done is they go in, maybe scrape it out, remove the gums. They may have to stitch up the gums?
Oh yeah, they always do.
Okay, so they're stitching the gums.
Yes.
Putting it back. And you were saying that sometimes they'll do like one side of the mouth and you can't get the patient back in for the other side of the mouth.
Correct.
Elaborate on that. What does that mean?
Well, patients want to be healthy, and they want to follow their practitioner. So they're told that this would benefit them. So they go ahead and have, let's say, one quadrant done, not necessarily a half. They have one quadrant done, and they begin to think, I'd almost rather have the disease than the cure.
Really?
Patients don't know where they're going to end up when that happens. They can end up with the gums shorter, showing more of the tooth, which aesthetically is a compromise, but it can also cause a problem with sensitivity to temperature and also collecting food.
Okay.
With the laser, we're able, ideally, to keep the gum right where it was. So we don't have anywhere near the recession. We don't have the gaps between the teeth. We don't have the suturing. We don't peel back the gum tissue, so you don't have that part of the inflammatory process kicked up. You know,
It's effective. So the laser what? Targets
the diseased tissue.
And kills it.
That and the bugs that cause the disease. And also the tartar that's adhering to the root of the tooth. Helps loosen that up.
Okay, so I get this correctly. Okay. So you can either, traditional dentistry is either cut it out or laser it out.
Zap it out, yes.
Is that right? Okay, now you brought a video.
Yes, I did.
Okay, and what are we going to look at in this video?
You're going to see an animation of the laser doing its job.
Okay, let's go to that video. What are we looking at here?
This is an animation of the laser gum treatment. Right now we have the first pass of the laser targeting the diseased tissue lining the inside of the sulcus, targeting the microbes.
What is the sulcus?
The sulcus is the trough between the gum and the tooth.
Okay.
They're the microbes that we're targeting.
Interesting. So that thing is just killing all the bacteria?
The bacteria, the diseased tissue, and it's loosening up the tartar that's adhered to the root.
What's this?
That's the tartar. This is the piezo scaler that'll be getting it off. It's got an irrigation solution to it. So when we do the procedure, there's some water that we're suctioning up. This is the second pass of the laser. It's finishing up, cleaning up the diseased tissue. It's also, the laser energy is activating the red blood cells and the fibrin to help form the surgical clot. I like to refer to it as nature's Band-Aid. We want that to remain there for a good 10 days. No brushing and flossing.
And the patient doesn't really feel anything? Or very little?
Very little. They know we're there, but we use local anesthetic.
Interesting, interesting, very interesting.
Randy, I've got one patient who 25 years ago, she became a patient of mine. When I first got out of dental school, I was doing gum surgery. But then I found out the complications the patients were having and to get the patient through the process. So I referred to the periodontist at that point. I referred Peggy to the periodontist. She had 4 quadrants of gum surgery done. It was maybe 6 or 7 years ago, the disease returned. Now I had the laser. Peggy and I have a good relationship. She said, okay, let's go ahead and do it. She trusted me. The day we did the first half of the mouth, she was anxious. She was shaking. She was crying, just petrified in the chair, because she could just remember from the first time she'd had the surgery. She allowed me to do it, sent her home with just ibuprofen. I called her that night. She was fine. She was relaxed, at peace, and the ibuprofen was taking care of it. She walked in for the second treatment, and she was fine. She's, what a world of difference. And
from the
traditional surgery. And that's not an unusual occurrence. I can't say it's going to happen every time, but it's so less traumatic to have it done with the laser.
Now you're saying, aside from getting punched in the mouth or an accident or whatever, this is how you lose your teeth.
Yes.
Is periodontal disease. Is that correct?
Correct. Periodontal disease, untreated, because it's a nasty disease, it doesn't hurt until you're going to lose your teeth. So it doesn't give you a heads up. You can't get a plan. So that's where, Randy, as I've spoken to you before, is get in early.
So bleeding gums, puffy gums, hot and cold sensitivity as well?
That's signs.
Bad breath?
But a lot of times that doesn't motivate people.
Okay.
People can drive their car with bad brakes. It's not until they get them fixed. It's like, whoa. It's the same thing with periodontal disease. Until you have it treated, you're not even going to be aware of the symptoms you had.
Interesting. Okay, you brought photos. What are we looking at here?
Okay, here we've got Noreen.
All right.
Up here in this photo is her before picture.
Okay.
Looks natural. Okay, she's 50 years old. She's got some wear in her teeth. She's got some spaces. That really was an issue for her. The issue is in this picture here. Right here, Randy.
Oh boy.
Is a surgical drain. Okay. Noreen went and saw the oral surgeon, and her infection was too severe to be able to treat right then and there.
Infection meaning what?
Bacteria.
Periodontal disease?
Periodontal disease.
Okay.
She had advanced periodontal disease. Anybody that knows pockets, the larger the number, the worse the disease. She had over 10 millimeter measurements. These teeth are ones that dentistry would consider hopeless.
Does it hurt when they chew?
Yes. Yes, it does. But that's not what motivated her here.
Okay.
What motivated her is her face swelled up. So what she had to do was go to the oral surgeon, they had to lance it, they put in the surgical drain to let the bacteria get out of the area, and she was sent home so that she could come back so they could take her teeth out. She heard that we keep teeth. We're able to save teeth.
She heard about you?
Yes.
Okay.
Yes. Me and the office. I don't do this alone.
All right.
And Noreen came in, and she heard that we could save teeth. And this is the first time I met her. She's got a surgical drain. Okay. We started treatment. We did the laser treatment. We saved her teeth. So what we had here were teeth that were already condemned. They had to come out.
They were told they're okay.
Noreen comes to us. What can you do? Well, we treated the whole mouth, but especially this area. We were able to go in with a laser, zap the bugs that were causing the disease, and Noreen still has her teeth to this day.
All right.
Now, Noreen's thinking, I'm getting to keep my teeth. She thought she was going to lose her teeth. So now that after we successfully kept her teeth, she wants to know what can we do to make things look better.
All right.
So we went ahead and we restored her 6 front teeth there with all ceramic crowns. Natural, healthy looking teeth. And if you were to look real closely at this picture, you'd see on her upper right that she still has a splint. Because in order to save these teeth, we had to join them together to tighten them up in the healing process. Once they were healed, then we don't need that splint anymore. So after we got those teeth done, Noreen said, I want the whole thing. So we restored the other 4 upper teeth. We power whitened her lower teeth. And Noreen is just so proud of her smile now. She tells me, she said, I thought I was going to lose them.
Okay.
I thought I was maybe going to have a good looking set of dentures. But I've got
right?
good-looking teeth that are my own. They're in. They don't come out. Not only does Noreen now have good-looking teeth, she has teeth that she can eat with comfortably. She can eat everything she wants.
She couldn't before?
She didn't know how limited she was.
Okay.
People will just, they'll compensate. They'll know if they bite down on that, it hurts. If they bite down on this, it doesn't hurt. But once you get the mouth stable, they find they can eat a lot more stuff than they had limited themselves to.
Okay. Now, do people still tell you? I mean, nobody likes going to the dentist.
Correct.
Do you hear that all the time?
Maybe every afternoon.
Is that right? What do they say? What do they say to you?
I hate being here.
Really? Do they ever say, hey, no offense?
No.
I don't like the dentist?
No.
Just I hate being here.
Randy, you talked to a lot of dentists. You know what they have to say.
Well, no, I want to know what they tell you because you seem like a likable guy. It doesn't seem like you're going to get that.
I'll tell you a quick story here. 17 years ago, my father passed away.
All right.
My mother calls me up. I go over. We go to the funeral home. We're in there, this attractive gal. They're going over the obituary, my mother and the gal, and talk about my sister. And then my mother says, and his son, Brendan Dwyer, Dr. Brendan Dwyer. And the gal says to me, what kind of doctor are you? And I said, I'm a dentist. And she said, I hate going to see you. I'm there, my father is at room temperature in the other room, and you're climbing over that to tell me you don't like dentists.
Interesting. You hear it all the time.
All the time.
Now, do you get these people that come in, they're deathly afraid of the dentist, and now all of a sudden they like going to the dentist, and they get the kind of the bug where they come in every 6 months like they're supposed to?
Correct. And they're surprised at how comfortable the mouth is, how it doesn't tear them apart when they have a cleaning. I mean, if you go once every 5-10 years, it's going to be an uncomfortable experience.
Are there people like that?
Yeah.
A lot of them.
Yeah.
So you welcome those people. You're not going to guilt trip them when they get
No. I'm not going to say where you been. No.
All right. And you're big on technology. I mean,
Yes.
people just tuning in. I mean, you have you have the things that make crowns in one day. You have the new laser to treat gum disease.
If you're a tradesman and don't have the right tools, you're not going to get the good job done.
Okay.
You need the right tools.
All right.
So I've got the tools.
Okay, good. Next photo. Let's take a look at what else, and then we're going to take a quick break. What are we looking at here?
Okay. Randy.
Oh, my goodness.
Here we have Ron.
What is that thing on the bottom tooth?
It's a problem. Ron was putting in, probably a tube of super glue a day to hold his lower front teeth in. It wasn't a predictable result. It wasn't a cosmetic result.
Okay. All right.
So Ron had different things going on. He had, I talked about Noreen, we were able to keep hopeless teeth. Well, these are hopeless teeth I can't save. When the only thing holding them in is super glue. Okay, there really
I can't believe
are
people put
hopeless
super
teeth.
glue in their mouth. Okay.
Not many.
Okay, so with him, they had to go.
We were able to save 3 teeth there. We had to get rid of the disease. All the bugs that were in the gum, we took that red, green gum tissue that smelled and get it nice, healthy pink, hold the teeth tightly, and they were able to anchor a cosmetic dental result, bridge work there. And then
So when you use the laser
yes,
for this gum disease, the gums get healthier?
yes, they do.
Okay.
We get rid of the bacteria, the disease process. The bacteria cause disease process in the gums. We get rid of the bacteria. We get the gums healthier again. We get them to attach to the teeth at a higher level, or the same level, and we firm the teeth up.
So with this person, what did he get? I mean, what am I looking at there? Because it's like a nice smile.
So what we were able to do is to hold on to 3 of his own natural teeth.
Okay.
Get those nice and healthy, stable. Then we applied a 6-unit bridge, cosmetic bridge, removable partial, and our drop-dead gorgeous denture. And the denture, if you notice on the smile, we're able to show more of the upper teeth because we restored the vertical dimension on the lower third of the face.
Huge difference.
Yes.
Obviously, in the way things were before.
As he told me, it took a while for him to tell me, how it had changed him. Patients, delayed gratification is very common in dentistry. And it was about a year later when he came in and told me he was at a family reunion, and all of his relatives told him how much he looked like his father. And to him, that was a tremendous compliment. I mean, because look at where he started. It's been a while since he's had any confidence in his smile.
Wow. I mean, nobody's going to smile with that mouth. Obviously.
Right. They're not going to eat with that mouth either.
Do you think, is that your take? There's a lot of people out there that you think are stuck up or serious, and they just hate their smile?
Right. They're the people that don't smile.
Interesting.
It could be thought that they're pouting, because they can't smile. Because if they did, they know, they watch people's reaction when they do smile. And so they know how to hide that. because they don't want to see that look.
So bleeding gums. Okay, let's just take that for a second because they have gum disease. I mean, if their gums are bleeding routinely, or they have to avoid flossing because of the bleeding gums.
You know, it could be an early sign of gum disease. It could be you just got to floss every day. Or it could be it's advanced and that you need treatment if you want to stay out of the denture. Are they headed? I
mean, if you have, like you say, these pockets,
yes.
I mean, you're headed for tooth loss, period.
Correct.
For dentures.
Correct. Or no teeth.
Okay.
That's the worst. I mean, if you end up in dentures, that's bad. But there's a large percentage of the population that can't tolerate a denture. So they just become social hermits. Okay, they don't go out.
Well, of the 20 million people on the internet that they say either have an upper or lower denture, okay?
Yes.
Most of these from, as you say, periodontal disease. How many of those do you think, if you could have got them early enough with your laser, could have stopped it?
Oh, early enough? All of them.
Really? Okay.
Right. Now, early is better than later, but later still isn't bad.
So even if somebody really has their teeth are loose, they're starting to slowly fall out, you go in there with a laser, kill the infection, their teeth get healthier.
Correct.
That's the part I don't get. I mean, how do you take a loose tooth and all of a sudden now it's not so loose?
Well, like on Noreen, I had to splint the teeth together. Okay. What that means is I'm anchoring 3 or 4 teeth together to get strength. United you stand, divided you fall. It allows the teeth to stay stable while the reattachment process happens. And that can take 6 months or so, 6-9 months.
Okay.
Let me show you one other case that I have here.
All right.
This is Ray. As you can see, Ray's got some dark teeth. He's got some missing teeth. Ray is an outgoing guy, but he talks with his hand in front of his mouth.
Okay.
That's just the habit he has. He came in, he had an abscess tooth. We ended up doing root treatment. It had been a while since Ray had been in the dental office. He realized now it's time to address things. He was comfortable with us, and so what can we do for him? I mean,
but you see this all the time? I mean, people that come in with really disastrous mouths,
first time
you can clean up with the laser and other procedures?
I didn't even know who Ray was. He came in with his girlfriend. He was petrified. She brought him in.
Really?
This is an outgoing guy, but that's not what you meet sometimes in the beginning in dentistry.
So after you do it all of a sudden their personality changes. Do you see that?
Absolutely. Oh, and they're comfortable
just because
with
of their teeth?
Well, when you talk to somebody, they're looking at your eyes or your teeth.
Okay.
And so if 1 or 2 are out of action, like they were here with Ray, he's holding back. I mean, he's a lot more social now. I mean, he's smiling all the time. His life, I think it's a life-changing thing.
Okay, good. We're going to take a quick break. We come back, drop dead gorgeous dentures. You're saying you could make a beautiful denture.
Correct.
Is that right?
A beautiful smile.
Okay. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with gum disease and also drop-dead gorgeous dentures. And with us, we have an expert on the topic, Dr. Dwyer. Okay, a recap though. Final message to somebody bleeding gums, hot and cold sensitivity, loose teeth, bad breath, all of these things. Maybe they've been told they have pockets. What do you want them to know? What's the first move?
First move is get to the dental office.
Okay.
That's the first thing. Early is better than later, as I said before, but we can still deal with later.
Okay, good.
Today we can work with advanced cases and have people still keep their teeth.
All right, good. Now, drop-dead gorgeous dentures. Is this a popular item?
It is. Somehow the denture wearers have been left out of this cosmetic smile.
Interesting.
People that are whitening their teeth or people that are having all ceramic restorations, very natural looking. The denture wearers are being left out on that. So what we came up with for people that can wear dentures,
okay,
because not everybody can, but if you can wear your upper and lower denture with these new patented teeth, because they also have improved chewing ability, not only aesthetics, but function, we're able to get people to have a smile again, a smile that they're proud of.
Because I feel like I could spot a denture wearer.
You can.
I mean, they look very flat, very straight.
Usually yellow.
I saw some of these pictures in your ad. These don't look like dentures.
No.
Let's take a look at that. Let's take a look at this. Okay, so this is one of your ads.
When you look at that lower picture,
okay,
you'll see more of the upper front teeth. The other thing you'll see, when the incisal edge blends into the side of the tooth, you have curves. It's not flat. Like on the top picture, all 4 of the front teeth are flat. And the canines kind of point down a little bit from there. Now, on the lower picture, the incisors all have curves at the corners of the teeth, for lack of a better way of explaining it.
Well, how come they didn't think about this years ago?
Somehow denture wears are just brushed aside. You lost your teeth, there's your denture.
Like a phony, perfectly straight teeth. Okay, so this is a sexy smile. I notice you have soft, executive, sexy.
Right. And
so they pick their denture, or do you help them pick?
Usually we help them pick. Yes, we do have it broken down there. And I've had some patients say, why do you have to bring sex into this? But going back to what we were talking about, when people talk to you, they're looking at your eyes or your teeth. If you're not confident with both, you're not confident.
So what's the difference, though, between a male denture, female denture?
Okay,
The basics.
Female denture is softer. You got curves. You might have one tooth slightly overlapping, like a lateral incisor, overlapping the central incisor. With a male smile, the teeth are bolder. The 2 front teeth might be prominent. The canines might be a little bit more prominent. It's not as fluid.
Interesting. Aggressive, active, dominant. So these dentures, beyond just looking good, okay, I think anybody looking on these, and we'll put these on the screen, they look good, but they stay on better, I think you said.
Yes.
So they're made differently.
The lower teeth have embedded in them surgical stainless steel. That stainless steel helps you eat things the denture wearers have difficulty with. Things like lettuce, meat, vegetables, carrots. I've had patients that have had, conventional dentures, and they come back and they say, I can eat so much better.
Okay. Now, this was, Jay Leno showed this ad in the Tonight Show. Is that correct?
Yeah, we've got that in it. He had some fun with it. He said that all the teeth look the same.
All the teeth. Well, when you get a closer look, they don't. They look completely different. It says, never be ashamed of your dentures again. Do they tell you, do they come in and they say, I'm so ashamed of my denture? What do they say?
They say that, but not necessarily using those words.
What do they say?
They don't like their denture. They're envious of people with a nice smile.
Okay, so what do you say to the person that has an older denture and they don't like it? Come in and get evaluated?
Yeah, we can take a look at it. Complimentary consultation. I'll look at what you got and I'll let you know what I think we can do for you. It's amazing the patients I see come in, and I get a piece of floss. I put it down from their forehead to their chin, right down the center, to see where the midline is. And I see teeth where they're a tooth off, one way or the other. Or, I get that floss, and I go from the incisal edge of the teeth up to their eyes, and, okay, we have asymmetry in nature, but we don't have to aim for it,
Okay.
if you end up there. But the edges of your teeth should line up with your pupils. The midline of your teeth should be in the middle. And the lower third of your face should be full.
You have a picture, I don't know where it is, but I saw it in the green room, where a person's face is collapsing, like the nose and the chin are touching. What was that all about?
They had lost the vertical dimension. The other thing they get is deep lines in the corner of their mouth, to the point where they get saliva building up in there and get a fungal infection. That's when the lower third of the mouth has collapsed.
Okay.
That's from years of wearing dentures.
In this economy, do you find people wanting to invest in their smile? Competing in the workforce? Things like that?
Competing in the workforce, yes. Or just feeling comfortable about themselves. Randy, I have some people that come in with dentures that are 30 years old.
Really?
Really. And this is something that's involved with their daily function, their speech, their smiles, and it's 30 years old.
So do they ask for a drop-dead gorgeous denture when they come in? Now, you coined that, is that right?
No.
But you use it. It's a good line.
It's a term we use, yes. People don't come in saying they want that, but they want it without saying it.
They want an improvement on their smile.
Correct. And their function.
Okay. And final message.
Yes.
Because we didn't talk about cosmetic dentistry, et cetera, but in your practice, you said you're changing smiles all the time.
Correct.
What do you say to the person watching this? They don't like their smile. They may have periodontal disease. or they find themselves covering their mouth or just not smiling because they're ashamed of their smile. Mm-hmm. What's your advice to them?
First of all, that we can do something about it, and we can do it comfortably, and we can do it in a way that people aren't going to notice that it was done.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thank you, Andy.
They could go to your website, take a look at these photos,
Absolutely.
And if they have been told they have gum disease or loose teeth, these kind of things, you recommend the laser.
I do it on myself.
All right. I want to thank you so much for coming in. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.